lab space? Is anybody working with TB cultures? How do you know your patient's got TB? Because the doctor tells you?
Screening.
Eh?
We do the screening.
You've just
and
been,
sent to
okay, so you've been told that the person, so how did the person before that you spoke to know that patient's got TB?
Last time I checked, there are 4 or 5 questions that are asked for each and every person.
But how do you know that somebody's told them or told you they've got TB? So how did they diagnose they had TB? With a sputum. Okay, so is that sputum infectious? Okay, so we had a discussion with the group earlier. How big is a TB particle? Anyone seen one lately? A TB particle? Okay, good. Exactly that. Because we deal with a medium that we cannot see. Okay, I'm in the air business. And air transports TB particles. Okay, so we would identified that somebody has got a sputum, done some diagnosis, and said, here's the flag, this patient has got TB. Let's put them onto treatment. Okay, but that diagnosis has to be done by a lab tech, and this is where they'll probably be using what we call the magic box, a biological safety cabinet. But they would be working on that sample to identify and isolate if it is TB. So we've got room air coming under the work surface. It goes to the back of the unit, we call the rear plenum. It comes in as a fan here that's spinning, turning, sucking the air. So this is a negative pressure plenum, and it pushes air out. This is a positive pressure plenum, and we have HEPA filters. Does anybody know the meaning of HEPA filter? Anybody ever heard the term HEPA filter? Okay, HEPA, high efficient particulate air. Okay, so it's a high efficient filter. So similar in layman's terms, if you go for surgery in an operating theatre and you're having a hip replacement, you're going to be on the table for 5-6 hours, you don't want to come out with an infection. The surgery was painful enough. You don't want an infection. So most operating theatres have HEPA filters to remove all particles. You know, literally they will remove all particles out of an airstream. They will not remove gases. Air is a gas. Air will pass through it, but we remove the particles because TB is a particle. It's attached to a particle, very small particle. Okay. So air is blown down over the work surface to create a sterile workspace. That hip replacement, you could do it inside there. You'll have no infection. Okay, it's a sterile workspace. We said what comes up must come down, what goes in must come out. Okay? Does that make sense? All right. So, anybody here a runner, a jogger? Anybody run the Comrades? I wouldn't. I'd watch it on TV, but I'm not running it. Okay, so we talk about speed. Those guys, anybody ever caught speeding in their cars?
every day.
Yeah, all that I'm not alone. But we talk about covering at 120 kilometers an hour. We cover a distance of 120 kilometers in 1 hour. Okay? So who wants to tell me what speed that air is being sucked in at? I'll take random guesses, I don't mind.
Second.
So 1 meter per second? The guidelines, and we have standards that tell us, because when we deliver this to your lab, we have to prove it is doing the job it's supposed to do. Okay? So we have the European standard, the American standard, and South Africa, we have our own standard. So South African standard says, SANS 1050 says to me the inflow needs to be a minimum of 0.4 meters per second. Minimum. So it's 0.4 of a meter, which is what? That's probably 0.4 of a meter in 1 second. That's the speed that the air is moving. Okay, but that's over this opening aperture. What happens? I've got a gentleman over there, very tall, can't get comfortable on the stool, he's sitting a bit too high. He opens the sash so he can work a bit more comfortable. Okay, cabinet's going to go into an alarm. The fan is relatively stupid, okay? Not completely stupid, but it's relatively stupid. It doesn't know what's happened. So that 0.4 meters per second was over this area. I've doubled it. What's happened? My velocity, my speed has halved. So now it's operating at 0.2 meters per second. Okay? And that's proven not to be safe. That's why the standards, minimum of 0.4 meters per second. You'd be amazed how many people we've trained how to work in a safety cabinet. We go back 6 months later, sash fully open, and they can't see through the glass screen. And okay, so just to prove. You see how much slower the smoke goes into it. If you were in a lab environment, would you be placing this cabinet close to a doorway or close to traffic? Can I have a volunteer, please? I need one volunteer. Anybody? Thank you, sir. Thank you. I want you to walk past. I'll tell you when to walk past. And we're going to observe what happens with the smoke. So, okay, walk past fast. Fast. Okay, come a bit closer. I want you to walk past over there. Okay, see what happens. Basically, you're coming past, and this is where you never put a cabinet. Thank you very much. You never put a cabinet in a high traffic area. You put it in the corner of a lab, never where people are going to be walking past. So after every day, good housekeeping. I'm very bad at housekeeping, but good housekeeping, you would have 70% alcohol spray bottle, spray down the surfaces inside, wipe down, let the cabinet run for 5-10 minutes. Depends on where you work. Some places want the cabinets running all the time. Some, they say, switch them off. Look, in South Africa, we have Eskom. We have no choice. Switch it off, okay? But you always wait, before you start working, you always run the cabinet for 5 minutes, clean out any aerosols, because continuously cleaning the air. And when you finish working, spray down 70% alcohol, wipe down all your surfaces, leave it running for 10-15 minutes. If you need to switch it off, you switch it off. Okay? Anybody know why we use 70% alcohol to clean as opposed to bleach? Bleach is great for TB, kills TB well, but what does bleach, sodium hypochlorite, do to stainless steel? It'll corrode it. It'll corrode. You'll basically, if you have to put bleach on the stainless steel, it's a matter of time before you don't have much stainless steel left. Okay? So that's why we suggest 70% alcohol. Anybody know why 70%? Why not 100%? It'll evaporate too quickly. Okay, it evaporates too quickly, so you make it 70%. So at least there's, we talk about from a biosafety point of view, if you had a spill, you need to basically decontaminate your space. You want to spray a disinfectant suitable to the agent you're working with and make sure you kill the agent. But if it's 100% bleach, it'll evaporate too fast. Okay. Does anybody have any questions? Yes, sir.
I wanted to find out, how do you monitor the UV light? You say that over time.
You get UV light meters. Okay, so you get UV light meters. And something I need to mention is the people doing the work must be qualified to do the work. Okay, so the guys must be trained, certificated to be able to do HEPA filter integrity testing, basically measure the airflows and measure your UVC. So you can, nothing would stop you having a UVC meter, but you need to be trained how to use it. Because you can't, let's face it, the glass refracts UV. Okay, so with the glass closed, I'm safe from exposure of the UV because of the composition of the glass, it refracts the UV. But that's why I can't run that UV with the sash open.
So how long does it usually last? Let's say especially those ones that you have in hospitals where they put them like at the ceiling.
Yeah, so basically we normally, like with safety cabinets, the manufacturer will normally indicate 1,000 hours of use. how do you measure 1,000 hours? You say, well, I'm going to use it every day for 1 hour, 365. That's 365 hours. So every 3 years, I will replace the UVC. So it's got to be part of your maintenance program. You know, it has to be budgeted for. You've got on your maintenance. You need to change these things. They don't last forever. Really don't last forever.
So even if you have it on like 24 hours a day, so it's still estimate around 3 years?
No, 1,000 days. So if it's on 20, look, you would never have it on. So for, and that's a good question for Toby for the upper room UVGIs. What is the time frame? I'm sure each manufacturer will say mine goes so many hours. There will always be punts. Whose is better? But my opinion, safety cabs are normally talk about 1,000 hours of use. Any other questions?
At the 7th South African TB Conference in Durban, ETTi presented Airborne IPC workshop. All lectures and exercises can be found on the ETTi website.